Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Dr. Aya Nuruddin is a scholar at Princeton University of Race and Science in the early 20th century. We discuss one focus of her work from that era, the collective efforts of Black public health officials and physicians to improve the health of Black communities, which she has written about as Black public health. Let's listen. Dr. Aya Nuruddin, thank you so much for joining me on Public Health on Call. You are a historian, and among the different topics that you have studied is Black public health. And I'd like to just start by asking you to tell us the story of Black public health.
Where I begin the story of Black public health, I think I would argue that other folks might pinpoint this at a different moment than I do. But I focus really heavily on the late 19th and early 20th century and the ways that Black physicians and activists and social scientists become concerned about the different kinds of health inequalities they're observing, especially among poor African Americans. There's really high rates of infectious disease, morbidity and mortality, really high maternal and infant mortality, and they become really invested in understanding what the causes of that are. And I would argue that that's kind of the emergence of a Black public health that's driven by Black people and their interests. Also, a lot of this work is really invested in disproving assumptions based in racial science about Black inferiority. So you have these Black physicians and social scientists who are studying, the causes of health inequality and why there are such high rates of disease and such high mortality rates. But they're making arguments that these are caused by environmental conditions, poor living conditions, poor housing, and a whole host of other, what we would maybe describe as structural issues now. And they're pinpointing those as the source of health inequality and making arguments that it's not actually rooted in sort of prevailing ideas about biological inferiority.
So it sounds like that they're both describing what is in front of them, but also very aware that there is a different explanation that is going maybe more broadly across society.
Absolutely. Absolutely. There's a sort of moment after the end of slavery and emancipation and Reconstruction where you have these prevailing arguments that without the institution of slavery, that Black people are going to die off, right? And this is a sort of prevailing idea that they will become extinct because all of these diseases and conditions and mortalities that emerge are the result of the absence of the institution of slavery. And so these Black doctors.
Just to pause for a second, that's not hyperbole. That was really what people were arguing at the time.
Yes, that is not hyperbole. People actually genuinely believe this. And Black physicians in particular, but of course, other Black scholars, intellectuals, and activists are also writing against this, saying slavery isn't the solution and slavery isn't why we're, or the absence of slavery isn't where these problems are coming from. And they're sort of pinpointing very early on that like racism itself is causing these issues rather than these arguments about like biological racial inferiority.
So interesting. Who are some of the leaders at this time of this movement?
So there's, of course, very prominent figures like W.E.B. Du Bois, who are doing really important work in this regard. But there's also a number of Black physicians like John A. Kenney at Tuskegee, Dr. Midian O'Bousfield, who was one of the presidents of the National Medical Association. And I should also point out the National Medical Association as an entity is really spearheading a lot of this as well. And a lot of the Black physicians that are members of that organization are actively writing about what we would now call like health inequalities. There's also a lot of sort of grassroots work around this as well, because segregation is so rampant. There are a lot of institutions that are not serving Black people and are sort of uninterested in resolving the issues facing Black people. And so you get a lot of smaller, local, community-based organizations that are doing smaller programs to sort of alleviate particular issues in their local communities. And then one of the sort of biggest, efforts that emerges out of this kind of grassroots impulse is National Negro Health Week, which begins at Tuskegee in 1915 with national observances across the country, but then is ultimately sort of absorbed by the US Public Health Service.
So let me ask you about that. So you have this emerging argument, late 19th, early 20th century, that the social conditions are really driving these health problems. Don't blame people for the diseases that they have. Help them, basically.
Absolutely.
And then there's this action arm of this movement too, which one of its manifestations is National Negro Health Week.
Yes.
What would that look like? What did that look like when it started?
So National Negro Health Week built on earlier efforts from something called the Negro Organization Society that was doing a lot of health education type programming in sort of rural communities. And National Negro Health Week, spearheaded by Booker T. Washington at Tuskegee at the very end of his life, but then taken up by his successor, Robert Russell Moton, and then a sociologist at Tuskegee named Monroe Work, who Monroe Work is really interested in, I guess what we would think about now is like quantitative social sciences. And he does he's really interested in demographic data and sort of studying and sort of collating all of these statistics about Black life. And this is his magnum opus is basically something called the Negro Yearbook, which is a sort of encyclopedia of all of this stuff. And so him and Moton and other folks sort of used Tuskegee as the launch pad to create basically a framework for these public health projects. And so what local communities could do is basically send a letter to Tuskegee saying, we would like to have an observance of National Negro Health Week in Baltimore or Philadelphia or LA or anywhere. And they would get basically a packet of instructions and say that would lay out, this is how you observe National Negro Health Week, which had been typically in April. So these observances would all occur all around the same time, but in different parts of the country. And they would include information about how to give a health talk and which days of Negro Health Week you should observe. So there would be each day had a specific observance. So like there would be adult education day or school hygiene day or things like that. And they would tell you, these are organizations you can contact to have a physician come and do, exams on children, or this is how you can get in touch with Black nurses. These are organizations that'll give you funding to do this work. This is how you write a health sermon. This is how and they would get these instruction packets from Tuskegee and be able to carry on these observances with that guidance.
What happens to this movement as we get deeper into the 20th century?
So National Negro Health Week, the observances sort of end in the early mid-1950s. And the National Negro Health News also stops being published around then as well. And I still need to do a little more research about why it ends in the way that it does. But there is, I think, a shift away from the government funding these grassroots efforts and instead moving into other kinds of public health programming institutions, et cetera.
And yet the theme of this work seems so relevant today, particularly as we think of the impact of racism on health.
They're naming racism as a public health problem very early. They're talking about what we would think about as like social and behavioral determinants of health, but they're thinking about them almost a century ago, which is one of the really interesting things that I think is useful for what we can learn about Black public health in the past to maybe think about current issues regarding health inequality. They're specifically naming racism as a public health problem. They're saying we have this lack of access because of racism. People live in these substandard housing conditions because of racism. There's not clean water because of racism. There's issues with pest control because of racism. That they're thinking in these terms very early on and in ways that are sometimes strikingly similar to how we talk about health disparities and health inequality in the present.
And yet a lot of this history is not appreciated.
I would agree.
Tell me more about that. What do you think has happened and what's the purpose of rediscovering it?
I think for me, it became very visible and very poignant because of COVID-19. I was sort of writing a lot of this work while quarantining myself. And it sort of clicked in a moment when I was writing that these conversations we're having about COVID-19 and health inequality and access to things like testing and vaccines and these kinds of bigger structural conversations that we've been having over the last couple of years in so many ways resemble the kinds of structural conversations that African-American physicians and social scientists and activists are talking about in the 19 teens and 1920s. And understanding that these claims about structure and these claims about health inequality have a much longer history than I think we've recognized, because there's been so much emphasis on thinking, especially when we're thinking about, racial disparities, that we're often always in search of a sort of hereditary or biological reason for why those disparities exist, instead of looking at environmental conditions and looking at structural issues and these other things. And to see Black physicians 100 years ago naming those things while I was sort of in the midst of living through it was a really, really powerful experience.
This isn't something we're just coming to. This is something that has existed and we've turned away from as a country. Perhaps that gives more urgency for finally confronting it now.
Absolutely. Absolutely. And the physicians and other folks that I write about thought it was urgent then. The reason that they're doing all of these studies, like the Philadelphia Negro and all of these sort of sociological studies or Monroe work in the Negro Yearbook, is because they are seeing Black people dying at these astronomical numbers from all kinds of diseases that are not, killing off other populations at the same rates. And so they see that Black health is urgent, right? And addressing health inequality is urgent, but they also understand addressing health inequality as part of a struggle for political and social inclusion as well. And I think understanding this history also helps us to understand the relationship between medicine and public health and science to larger political questions. And I think sometimes our impulse is to disentangle those things, but the folks that I study see those things as very deeply interconnected. That Black political inclusion and equality is very much wrapped up in addressing health inequality in the same moment.
Dr. Nuruddin, thank you so much for joining me to talk about your work on Black public health.
Thank you for having me. This was great.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.